Սիրելի բարեկամներ, մեր հաջորդ ակնարկը պատմում է Հայ-ամերիկյան առողջապահական միության AAHPO-ի շարքերում գործող մեր բժիշկների հերթական հավաքույթի մասին։
Recently, at the Byblos restaurant in Manhattan, was held the organized meeting of the Armenian American Health Organization, also known as AAPHO. The main focus of this meeting was centered around two subjects. First, to discuss the health issues facing the people in Armenia, specifically the health hazards presented by tobacco use, and second, to assist young Armenian graduates from various backgrounds of medicine with finding work in their prospective fields. The evening was opened with remark by Tsoline Khajoglanyan, which was then followed by the Reformation of AAPHO's mission, read by Dr. Rafi Hovhannisyan. Dr. Hovhannisyan underscored AAPHO's commitment to improve the health care for Armenians here in the U.S. and in Armenia, and spoke about the successful work AAPHO has been doing for the past 18 years. Following Dr. Hovhannisyan's presentation, Dr. Arthur Kubikian asked all the present healthcare professionals to introduce themselves. It is important to stress that the meeting was attended by many young professionals, including many graduates from medical universities in Armenia. The presence of our youth serves as an important indication that AAPHO's future is secure and its mission is guaranteed to continue for many generations to come. Khora Nalbanjan then introduced the newly graduated medical students who are looking for work, once again underscoring AAPHO's commitment in helping young adults with the job placement program and guidance in the medical labor market. Dr. Aram Gazazian spoke about AAPHO's collaboration with Voice of Armenians TV and the importance of using VOA's platform to broaden AAPHO's message and appeal. President of AAPHO, Larry Najarian, spoke about the organization's successes over many years and thanked everyone who has contributed time and effort to AAPHO's mission. Dr. Kim Arzumanian spoke about the nutritional intake and education in Armenia and presented statistics reflecting this important health factor. She then introduced the evening's keynote speaker, Dr. Aroosyak Haroutunian from Armenia, who is currently stationed at Johns Hopkins Hospital and University and was also Dr. Arzumanian's student. Dr. Haroutunian spoke about the health hazards presented by the uncontrolled use of tobacco in Armenia.
Tobacco epidemic in Armenia, it's really an epidemic. All of these pictures are taken in Armenia. And the truth is that dying from smoking is rarely quick, but never painless. But tobacco consumption is only the part of the problem. The next part, the sad story about the smoking in Armenia, is exposure to second-hand smoke. There is a lot to do, but I am very proud to mention that we were able to have some achievements. And well, number one achievement that I want to mention was successfully developed advocacy campaigns that were done by our center and by the civil society. In 2008, by the request from the civil society and our center, this day was announced to be the National No Tobacco Day. And these are just the pictures from previous years, how we are celebrating these days. Mostly we are having some public events in the streets, trying to catch the public attention. It's the shame for me to mention, but there is no infrastructure in the health system that can fight against this tobacco epidemic, because smoking cessation guidelines are not endorsed. Healthcare professionals have no any training in smoking cessation. They are lacking skills, knowledge, and they are smoking a lot.
Just like in the previous AAPHO meetings, the health challenges discussed this time as well were not only confined to speeches and presentations, but rather served as a springboard for action.
Tonight, we're getting together to really energize our base, where we think about new ideas, share ideas, discuss them, and ultimately you will see them. We all bring to the table unique talents. Some of us are nurses, some of us are nutritionists, some of us are dentists, social workers, psychologists, as well as physicians. And what's unique to our organization is that we're able to work together as a team to provide the very best in care and preventive information, medical information, to the Armenian community.
Մեր գազագերբությունը AAHPO-ն, որ այսօր 17-րդ դարեթարսը կնշե, հաստատվեցավ մի քանի կարևոր ծառայություններ մատուցանելու մեր համայնքին, որոնց գլխավորն է օգնել հայ մասնակիցներու առողջապահական մարզի մեջ.
True to its nature and philosophy, AAPHO is dedicated not only to identify the health issues facing Armenians here and in Armenia, but also taking concrete and productive actions to solve our nation's health challenges one project at a time.
Շատ ուրախ եմ գտնվել այս երեկոյի ընթացքում այստեղ եւ ներկայացնել Հայաստանում ծխախոտի դեմ պայքարի ոլորտում արկա հիմնախնդիրները հայ բժիշկներին։ Կարծում եմ, որ շատ օգտակար են նման հանդիպումները, որովհետև կապ ենք հաստատում հայ եւ հայ բժիշկների միջեւ, որոնք գտնվում են այստեղ եւ Հայաստանում, որոնք շատ բան են անում Հայաստանի առողջապահական համակարգի զարգացման համար։ Շատ խորհրդանշական է այսօրը գտնվել այստեղ, որտեղ Հայաստանում ծխախոտի դեմ պայքարի ազգային օրն է այսօր, հոկտեմբերի 11-ը։ Ցավում եմ, որ չեմ գտնվում Հայաստանում իմ ընկերների կողքին, համոզված եմ, որ իրենք շատ լավ միջոցառումներ են կազմակերպել, բայց կարծում եմ, որ այս հանդիպումը նույնպես կարևոր էր նույն ծխախոտի դեմ պայքարի համար։ Հուսով եմ, որ մեր համագործակցությունը բժիշկների հետ կշարունակվի նաև այդ ոլորտում, քանի որ ծխախոտը առողջապահական հիմնախնդիր է Հայաստանում։ Հուսով եմ իմ հանդիպումը եւ իմ ելույթը այսօր որոշակի ներդրում կունենա այդ ոլորտում։